Hello, all. I'm delighted to welcome you all to this special Zoom call hosted by StafGo Health, your trusted partner in healthcare financial management. My name is Preet Sandhu, and I'm the founder and CEO of StafGo Health. Today, we will be discussing credentialing, contracting, insurance, and PPO negotiations. At StafGo Health, we're committed to revolutionizing the landscape of dental and medical billing, credentialing, insurance, and PPO negotiations. Our mission is to empower healthcare practitioners and facilities with precision, efficiency, and unparalleled expertise, ensuring optimal financial health and operational excellence. Our team at StafGo Health is comprised of dedicated professionals who are passionate about delivering excellence in healthcare financial management. From comprehensive billing solutions to specialized credentialing services, we tailor our offerings to meet the unique needs of each client, whether they are a small clinic, a multi-location practice, or a hospital system. Today, we have the privilege of being joined by a key member of our team, Laura Goodker, the Director of Provider Relations and Contracting. Laura brings a wealth of experience and insight to our organization, and she'll be sharing valuable insights into our credentialing, contracting, and insurance negotiation services. Laura is experienced managed care executive with a remarkable track record of achievements in healthcare industry. With expertise honed close to 20 years, Laura has played a pivotal role in driving contract negotiations, managing extensive provider networks, and optimizing reimbursements. I'll pass on to Laura now.
Hello, my name is Laura Gettiger. I'm an experienced managed care executive with a rich history of achievements in the healthcare industry. Over the past 20 years, I've had the privilege of driving contract negotiations, managing extension provider networks, and optimizing reimbursements. One of my notable accomplishments include ensuring the seamless transition of the new ICD-10 coding standards during my tenure at Anthem, who is a leading health insurance provider. Moreover, I've had the opportunity to effectively lead a team overseeing contracts for Allegheny Health Network, which comprised of 12 hospitals, 1,700 physicians, and 200 practices. Additionally, I served as Assistant Vice President of Payer Relations at GI Alliance, a physician-led group spanning 12 states and comprising over 600 physicians across 255 locations. I'm thrilled to be here today, and I look forward to our discussion. Thank you.
Very good, Laura. So once again, welcome to StafGo Health Zoom call, and thank you for joining us today. Let's make this session both informative and inspiring. All right, Laura, can you provide me an overview of the credentialing process for healthcare providers and facilities?
Yes, kind of starting from the basics with that. It would involve, choosing a payer. You want to negotiate with them. You want to be participating with them. So that would involve bringing in all your paperwork that you have, your licensures, your DEAs, and then supplying that information to the payer and following their guidelines. Each payer is a little different. Most of them are pretty standardized as to what they're looking for.
Very good. And how does StafGo ensure efficient and accurate credentialing for healthcare providers, considering the complex regulatory landscape?
With that, it is a very detailed tracking mechanism to do that. So making sure that we have the proper paperwork, that everything is current and is not go close to expiration with that, and making sure everything goes through timely, and then having a very sufficient and detailed tracking with the payer also to make sure that they are getting everything processed correctly and that they are not looking for more information as we're working on their credentialing.
Okay, very good. So can you share some effective strategies we have employed in negotiating with insurance payers to secure better reimbursement rates for healthcare providers who partner with us, particularly in context of PPO negotiations?
Yes, part of it is looking to see what the existing contracts are, kind of what the pain points are that you're as a provider having, and then researching what the payer market is in the area. So seeing who is probably your biggest clients coming through, and then seeing also, how are those impacting your revenue stream and impacting, what your patients that you're having coming through to your offices. And so with that too, it's just reviewing of what does it look like? How's it look like compared to Medicare? How's it looking like to standard market? And then we're negotiating that way. And it's not just on rates, it's also looking at language and policies to make sure that as a office, you can effectively follow those policies, but then too, the policies aren't also hurting you.
Of course, very good. Um, how does StafGo Health leverage data analysis and insights, industry insights, to advocate for fair and competitive reimbursement rates during rate negotiations with insurance companies, like basically ensuring that healthcare providers receive optimal compensation for their services?
Mhm. Um, excuse me. With that, it is taking a look at the public data that is out there and seeing just even on price transparency, which you can find, is running some reports and seeing what the comparisons are. Kind of just doing some deep dives on information that you can find to see how your practice is performing compared to how your next door practice is performing with you, to see where you're getting compensation at. And then two, seeing how from payer to payer that your plans are to each other and really maximizing those compensations against each other also.
Yes, it is very important to see what is going out there and comparing our top codes that our providers are using and so forth. It is important to do that research. And we have really comprehensive databases and analytical tools based on which we do it over here at StafGo. All right. So can you explain the enrollment process for healthcare providers, and how does StafGo assist them in navigating insurance networks and government programs?
Yes, with the enrollment process, it is a very detailed process with the payers. It is just making sure that all the information that they're requesting is filed at the same time, consistently and timely. Usually the challenges with the government payers, depending on how they are if it's a Medicare or a state plan, kind of how they are with the processing time. Some states are a little more behind than others, so that's where the biggest challenge is. And usually you need to have your government numbers first before you can have your commercial numbers. So they require that, and that can hold things up. So the sooner to start on anything, the better. And then that way, trying to, even at time that you may not have your government number, you sometimes can still work with the payers for the commercial line to get those enrollments started and get them ready so that once you get it, you can just slide it right in and they're ready to go.
Very good. So what role does contracting plays in operations and financial stability of healthcare facilities, and how does StafGo optimize contracting process?
Contracting has a big role with the financial stability because that is their revenue. So with that, it's really bringing in the maximum amount that we can possibly bring in with your payers, maximizing on what the rates are, maximizing what policies are, and really trying to bring in the most that we can bring in for your practice.
So how does StafGo help providers negotiate higher rates during contract negotiations, with the insurance payers?
Really, we go in very aggressively as we negotiate those rates. It is a tough market anymore. The payers are going with different strategies. And so it's going in aggressively and being creative too, as to how to work on getting those rates. Sometimes it's not simply just a straight face dollar rate. Sometimes it's working through the language and finding ways through that can still have an impact to what the revenues are going to be.
Yeah, and it is a long drawn process. It takes substantial amount of resources, research, and just comparing the data that is out there, and using a lot of analysis. We have several tools. A lot of them are Excel based, and we have a few other tools that we use over here to make sure our providers get the best rates. So next question. How does StafGo stay updated with industry regulations and changes, ensuring compliance with licensing, credentialing, enrollment, and contracting requirements?
With that, it's having a very detailed tracking mechanism to make sure that everything is essentially in either a database or a spreadsheet, and having everything very detailed on as to what timeframes are, so that everything can be done before any expirations occur and be on top of the process. Contracting, it's best to start at least 6 months before a contract is possibly going to expire or hit its renewal date. And as for licensing and credentialing, payers usually send out a notification, but sometimes that gets missed. So it's best to have an idea and have that detailed down as to when the next enrollment's going to be, when they are due for credentialing again, so that that can be put together and sent out to them and be proactive on the process.
Very good. So how does StafGo measures the success and effectiveness of its services, and what metrics does it use to track progress?
I would say with that, it's going to be a combination of looking at the review of how the contract has been performing with reimbursements, and looking at denial rates and probably of what the policies have been doing. Denial rates are usually a very good indicator as to how it has been doing, to see if it's been effective coding or if it's an issue with the payer. And so with that, that can really tell a lot of stories with that.
Very good. What advice would you give to healthcare facilities looking to maximize revenue through credentialing, licensing, enrollment, and contracting?
I would say to stay on top of your credentialing, stay on top of your enrollment and licensing. Really make sure that you have the dates in a database so that they can be effectively tracked, because sometimes when they send in notifications of you're due for re-enrollment, you're due for re-credentialing, it lands on a desk in Timbuktu and nobody knows where it went to, and it never gets seen again, or it goes into a mailbox that somebody has not been with the company for 3 years. So it's better to be proactive to have that into a database that is current and that the current person always has access to with that. And with contracting, it's staying on top of what your contracts are doing, really looking at those. It doesn't take much if you don't have that much time to really just kind of review of, hey, this is what we are getting for our contract rate. This is what it's looking like, but this is what our denial rates look like, and looking at the volume of that to see, really hone down as to maybe if there's an issue or how it's doing. And then that gives you an idea too of who you really need to focus on to work on a new contracting efforts.
Very nice. So can you discuss the importance of building and maintaining strong provider networks in achieving favorable rates for healthcare providers?
Yes, you need to have a strong network for the members. They are out there, and you've got to have that relationship with the insurances also, so that members first off will also be advocate to the insurance of, hey, we want this provider in your network. We really like this provider. And so working that way and building up a rapport with the insurances. Sometimes that can be tough working with them, but really finding a way to work with them, because you still need to work with them. You still need to have those payers. So, and having some bit of flexibility when it comes to rates. It's not always the easiest, but again, being creative as to how you can make that work.
Very good. So the next question is, what strategies does StafGo employ to advocate for fair reimbursement rates and fee schedules for healthcare providers?
Again, going aggressive, working on these contracts, going creative, working on these contracts also to find reimbursement rates, and really having some good data to back everything up, to really show where you're sitting in the market, to show how you compare it to other things, so that you can say, hey, we are way behind below what the average market is. We need to come up in our rates, and making that push with it. Again, it's being aggressive.
So you think a provider out there can manage all this on their own, or like it takes substantial amount of time and research? Do they really need services like what we here provide at StafGo Health, or there are a few other companies who do the same out there? So why do they need us? Is this something that that can be done by an individual provider or somebody running a healthcare facility?
The service the StafGo offers is the fact that we can focus on this. We can focus just working on this, where as a practice, you have only 1 or 2 billing people, or you're using another company, and that's not their focus. This is what we specialize in. This is what we focus on. So we can dedicate the time to work on these and really hone in on that for your practice.
Yes. So with your experience in managed care contracting, how do you ensure providers are fairly compensated for their services?
Looking at market data, finding out what other contracts are looking like, kind of looking to see finding out ways that other providers are getting paid, and then comparing to what the government plans are paying. It's a good baseline to review. It's a very standard baseline to review to, and how you're looking like to a Medicare plan. And that is a good way to really look and see how, what is going to be a fair rate to negotiate from that, as well as looking at what your operating costs are and how we can leverage off of that.
So I believe I've asked you quite a few questions, and we'll summarize it now. So finally, how can healthcare facilities benefit from partnering with StafGo for their credentialing, licensing, enrollment, and contracting needs?
The fact that they can now have time to focus on their practices. They can focus on what they've got going on. And then they can have us work on the fact that we can do their credentialing. We can track their enrollment. We can have those mechanisms in place for them. And that's one less thing that they really have to worry about, is they're just trying to focus on patient care and focus on their patients and their staff.
Very good. So basically, to summarize, we have discussed the credentialing, licensing, enrollment, and contracting process, and how healthcare facilities and individual providers can benefit by using what StafGo Health offers in terms of services, the specialized services. If anybody or any facility want to get in touch with us, they can email us at support@stafgo.com. support@stafgo.com. StafGo, STAFGO. Thank you all for your time. It was a pleasure talking to you, Laura. Bye-bye till next time.
Thank you.